Hey guys, welcome back to Medical Coding with Blue. Today's episode is all about not giving up your dream as a medical coder while you are in the job seeking process. If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, I will start off by saying this. There's going to be a lot of discouragement in the beginning when you're out there looking for a job. People who have no background in medical go through this, nurses go through this. But I got a couple of comments this weekend and I want to share both of them. But I want to share the attitude, the thought process behind both of these, because I think that it can resonate with a lot of folks, because I think we find ourselves in this position from time to time where, you know, we kind of get down on ourselves and maybe we don't know, maybe we're not really pursuing the right thing. And then there are those that are really tenacious and they say, no, I really want this, I'm going to go after it. So these two comments are the perfect example of each. So let's go ahead and get started. And thank you to the two that commented. So the first one, and this comment I love this comment, because this shows that what I share on my channel is not just for funsies, okay? This is to help you all. And for some that are just kind of resisting, oh no, and this and that and that and this, listen to this. So the viewer says, hi Blue, I'm an RN who stumbled upon your videos a year and a half ago. I was working so hard on the floor in the midst of the pandemic. Nights, weekends, holidays, and lots of overtime had me so burnt out. Your love for medical coding intrigued me. I wanted to love my job again too. After doing some research, I discovered CDI, Clinical Documentation Improvement, or Clinical Documentation Integrity, and set it as my personal goal. I did start off with the AHIMA self-paced coding courses, but I did not feel it was interactive enough for the money that they wanted for it. I followed your self-study advice, bought the books that you recommended, and started studying medical coding on my free time. I worked through the books one at a time. I started with ICD-10-CM, then ICD-10-PCS, and I had not started studying CPT at the hospital when the hospital that I was working for hadn't posted an opening for a CDS position. I decided to take what I had learned so far and apply. I was hired on as a CDS in April. The medical coding knowledge I learned with your advice gave me a huge leg up. I continued to study and learned CPT with your help and advice. My 2023 goal was to pass the CCS. I sat for it and passed on the first try yesterday. Since 2 years of experience is required to sit for the CCDS, I will spend the next year studying for that. I just wanted to say thank you for your advice and inspiration and let your viewers know that with hard work and dedication, it can be done. And that is a perfect example of just being tenacious and going after it and knowing that you have resources out there. My videos are a treasure trove, at least I think, of resources to help you. And look, she was able to pass her CCS. Now, yes, with the CCDS, there are requirements for that. And that is a credential through the Association for Clinical Documentation Improvement Specialists. And that is the gold standard of CDI credentials, okay? So that's wonderful, and I wish her so much luck on her journey, and I think she's going to continue to do fantastic, okay? Now, here's the other comment that they responded to this post that I had shared about this viewer. They said, I'm going to be transparent here. I got really discouraged by an interview that I had at a hospital system. The CDS manager, word for word verbatim, says, you're not old enough and experienced in nursing to be a CDS. I've been a nurse for almost 5 years. I have my CPC, so she told me that I pretty much need to be on the brink of retirement to be successful at CDS. I didn't know how to respond to that, and I haven't applied for any CDS jobs since. The job either requires you to have prior experience or practically too much of it. Haha. I'm at a loss. I have no idea what or how to pursue this field. All right, so here's the thing. This comment in particular did two things to me personally. It made me sad that somebody could literally get knocked off their horse and then just stay there because of one person's ignorance. That made me sad, because that's stealing somebody's whole future, because that person allowed somebody else to do that. Then the other feeling that I had was, it upset me, because really, that's all it took was one person to say something so ignorant that you don't have enough experience. You need to be practically retired because you have 5 years and that's too much. I mean, that's not enough. Really? What's too much is this person's attitude, this interviewer. And to me, why would you want to work at a place where the leadership is ignorant like that? I would have said, oh, okay, if that's how you feel, thank you so much for the opportunity to speak with you. I truly do appreciate it. And I wish you luck on your search. Thank you very much. And I would have left. Simple as that. Not being so stunned. Guys, things like this are going to happen. You are going, in this industry, you're going to run across all kinds of attitudes and all kinds of personalities and all kinds of knowledge bases. One of the best stories that I have for viewers on my channel was a high school graduate who had just graduated high school, got his certification in medical coding, right? Started off with a CPC. And then, not even 22. This guy is not even 22 years old yet. He is so knowledgeable about medical coding that he has gone from coding clinics and like in the clinic setting, and from coding same-day surgeries to auditing, and now he audits auditors. That's how brilliant that guy is. Everybody's knowledge base is different. Nobody should be judged by the fact that, oh, you only have 5 years of experience and that's not enough to be a CDS. To me, that sounds like a little bit of jealousy there, interviewer. I'm just saying. And for that kind of attitude, and again, that kind of small-minded thinking, I wouldn't want to work there anyway. There are plenty of other places to go, and not every employer is going to be as narrow-minded as this one. Now, keep in mind, again, when you're in this industry, and even when, and I certainly hope that this viewer continues to pursue a career in CDI, because if that's really what you want to do, I think that you should be able to follow your dreams. But you need to toughen up. There's a lot of you out there that need to develop a thicker skin. I see it all the time in the comments. Immediately wants to get discouraged, immediately wants to feel like the victim instead of feeling like the victor. This person felt like the victim. I mean, immediately, just based on their comment, instead of feeling like the victor, wants to feel like a victim. And I don't think that that's right, because of the simple fact that there's going to be people who are going to not like you this instant that they see you, and they're going to be jealous, and they're going to think all kinds of things. They're going to underestimate you. I can't tell you how many people underestimate me on a daily basis. This is either at work and even on the channel. And then when they get to know me, or they get to listen to the things that I say, then they're like, oh, well, now I see it's different. Yeah, because not everything is as you expect it to be or as you think it is. All right. So that's the thing. You cannot get so discouraged immediately, because if it's really that easy to knock you off your horse and discourage you, this field is not going to be for you. You will not last in it very long. This field, the health information arena, is for people who have a thick skin, who want to learn. The highly successful people are the ones who are going to continue to evolve. If there's things like this where you get very sensitive about being rejected, or you get very sensitive about what people tell you, you need to work on your response, because that's the only thing that you can control, is your response to a situation. I get a lot of people, nurses and brand new medical coding students and other medical professionals that write in and say, well, Blue, I've been looking for a job in medical coding and I can't find one. Everybody wants experience. And a lot of times that's what stops people from even applying, is because the employer says they want 3 to 5 years of experience, instead of just applying like I tell y'all to, right? I tell y'all to go ahead and apply, because everybody who's an experienced medical coder in your area is going to be employed. Now, if they want to switch employers, it's because there's something going on, or maybe they're not getting along with their boss, or, maybe they're about to be fired. There's a lot of reasons why. So somebody like you who's brand new and has no bad habits, they're not going to know who you are unless you get yourself in front of them with your resume, right? As far as like submitting your application, going ahead and applying anyway. And that leads me to my other thing. I tell y'all this all the time. Your resume needs to be that hook, because that's exactly what it is. People are not going to see you. They're only going to see your resume. If you don't have a good resume, you will not get a call. If your resume, if it's over 2 pages, it needs to be at least 2 pages. If it's 1 page, that's great. No more than 2 pages. If it's any more than that, you are not getting a call. If your name does not have your credentials next to it, right, you are not getting a call. If you are not listing all of the things that you learned in the school as your skills, you are not getting a call. If you are trying to list all kinds of crazy things, organized, team player as your skills, again, you're not getting a call. Why? Because those are your soft skills. When you're looking at a resume, if I'm a hiring manager and I'm looking at a resume and I see that on somebody's skills list, nope, next. Why? Because I need to know what skills are you bringing. And don't assume that I know that you're trained in ICD-10-CM, CPT-4, HCPCS Level 2. If you have ICD-10 PCS training, that needs to be on there. If you're telling me that you have ICD-10 training, again, rejected. Immediate rejection. Why? Because you didn't tell me if it's CM or PCS. And you may be thinking, well, Blue, that's common sense. No, I don't know. I don't know you from Adam or Eve. So I need to know what it is that you were trained in. I need to know what all things that you did in your past jobs, even though they're not related. I need to know, how do they relate to a job that you're going to get in medical coding? Did you have to safeguard private information? Did you do any cash handling? Did you have to work with Excel or Word or any of those things, right? Did you have any other skills that are going to set you apart? Do you speak Spanish? Do you speak German? Do you speak French? Any of those, any other language, sign language. If you have those and you're fluent in those, put that on there. And you may be thinking, well, Blue, why does a medical coder need that? You don't know what population your facility that you're applying at is servicing. Because if there's like people in there who speak another language, a lady wrote in and she said that she speaks Japanese. And there was a customer trying to pay their bill and they only spoke Japanese and they couldn't get a hold of a translator, and they knew, because she worked in another department, they knew she spoke Japanese and they knew she was trying to get in on the coding side, and they called her and said, hey, can you help us? And she went right over there and she translated for them, and now she works in that department. So you never know what skills are going to set you apart from the next person. But you cannot let one person's ignorance get in your way. If everybody let that happen, there would be no successful people, right? Do you know the hue and cry that I get from people all the time that says, well, no, Blue, you just don't understand. I can't pass an assessment test. Okay, if you can't pass an assessment test that the employer is giving you, it doesn't mean that you are necessarily a bad coder. Sometimes these assessment tests have a very high pass rate. Some are 95%, which means you've got to get almost everything right on this test. And some, it's 85%. And they still, anything less than 85%, they consider a fail. So while you're still getting a B, they're saying that that's not good enough for them, that you need a little bit more practice. And if that's the case, then you go back to those books that I've recommended, those workbooks, and you work through them until you can understand. And if you say, well, Blue, I don't understand, then what are you waiting for? You need to fight to understand this stuff. You either need to find a mentor or you need to find a tutor. Now, the difference between mentor and tutor, a mentor is not going to charge you, a tutor will. Now, sometimes that's necessary in this industry to hire yourself a tutor, because it's important to have that one-on-one interaction. And maybe the school that you went to, the teacher was not taught how to teach other medical, not other medical coders, but other adults, right? It's very important if you're a teacher, because some people don't have that natural gift. And for those that don't, they need they need training on how to do that, because not every instructor is as patient. And sometimes people let their pride get the best of them when they're in the school and they don't want to reach out for help. It's very important when you're an adult learner to reach out for help. Even if you think you got it, it never hurts to say, hey, teacher, can I just run this by you real quick? I just want to make sure that I understand. Okay, and if you're in a program that promised a teacher, then that is your right to do that. But if you find that your teacher was very impatient and didn't want to teach you, then that's when you need to take matters into your own hands and stop being a victim and start being a victor and being out there and saying, I don't understand this. Can somebody recommend a mentor, or can somebody recommend a tutor? If you do that on LinkedIn, there's a ton of people that will respond, because trust me, I've seen it all the time. I am a tutor. My rate is in the description box below, but there's a ton of tutors on LinkedIn. All right. So you have your choice, but you have to stop getting yourself into those situations where you're going to get discouraged, because you have to expect when you are out there looking for a job that you're going to get a lot of rejection, that you're going to be looking for a while. There's a saying out there that for every $10,000 per year you expect to earn, expect to be looking for 1 month. Okay, that's the bare minimum to be looking for. All right. But there's also other ways that you can get in. You can also apply for billing positions. If you don't want to do billing, then apply for prior authorizations. Now, prior authorizations is not coding, but it will get you exposure to the codes. All right. So those are some of the ones that I do recommend. You can also apply for risk adjustment. Now, listen carefully, because there is somebody out there who got really upset and they were crying and saying, no, you don't understand, and I just don't listen to you because you can be a senior risk adjustment coder. You're still only coding for diagnoses. For brand new medical coders, I say, sure, go ahead and start with risk adjustment. But don't get stuck there, because people tend to forget how to code for procedures, which means that you lose your procedures, you lose your ability to code for E&M, and you lose your ability to code for modifiers. Not only that, I've seen in job listings, because that is what I do. That is part of my job here as a creator on YouTube, is to make sure that I look in the industry. What all are they looking for? And I have seen employers that say, if your only experience has been in risk adjustment, this does not count as experience. I wouldn't have shared it if I didn't see it. So I want you all to know that it's a good place to start, because it'll get you kind of familiar with the electronic medical record, but do not stay there. That is what I've said, and that is what I will continue to say. I never said that it was bad. I just said it's bad if you continue to be that way for years. Because some people will be there for years, and then they will completely forget how to code for procedures. So make time, make the effort to get as much as you can get in as with the time that you're starting, okay? You want to be able to hit the ground running and be able to find a place that is going to give you that opportunity to code, not just diagnosis coding, but also procedures, either it's minor procedures or the same-day surgery procedures, and evaluation and management, because that way you can be that well-rounded coder. You can be that coder who has the opportunity to learn more things, right? Because the more you start learning things, the more easier it is to continue to learn things, all right? So that is what I would have to say to that. But don't lose faith in the process, guys. It's going to take some time, because remember, these schools are rushing people through, and employers are tired of having to get brand new people in who are certified, and then they have to completely train them from the ground up because they didn't receive really good training, or that individual didn't know enough to train themselves as far as like work on the workbooks and do all of these things so that they can learn and be prepared. So that's why the employers say, no, If you don't have all of these years of experience, then, you know, we're going to say that, right? But again, like I said, if you're in an area, all these employers, all these veteran coders are going to be employed. That employer still needs people. So they're going to take a chance on the candidate that's going to be able to give them the most for their money, which is somebody who has continued to study and who is being persistent. And they're going to notice that. That's what happened with me, guys. That's what happened with me. And I will tell y'all again and again, if you are not registered with a temporary agency, you are losing out. Because with a temp agency, and you can Google in your area, do not ask me, don't ask me, guys, because every place is different. And there's not one national branch that I can name. But if you Google in your area, temporary agencies for medical professionals, you will see a lot of them pop up. I did that for the city of Dallas. I am not in Dallas, but I did it for the city of Dallas. And wouldn't you know, there's all these ones that come up. Now, with these temp agencies, it's not like a day labor thing, okay? It's not just for one day. They will not call you to be a medical coder for only one day. They are going to call you in for, like, you know, maybe somebody's going on leave, for an extended leave, 3 or 4 months, 6 months, and they need somebody to come and fill in. Well, with a temp agency, you don't have to have all these years of experience. They need somebody who's qualified with whatever credentials that they're requiring, and they're going to send you in, because the temp agency is going to give you a test too. And then they're going to be able to set you up with this employer. Now you've got yourself and somebody else looking for a job for you. So before you write me complaining, oh no, I don't want to do that, I want a real job. Guys, this is how you get in. Sometimes you have to do things that are a little bit out of the norm, and instead of fighting against it, go with it. Because you're just working so hard, and then you're going to run into this defeated feeling of, I can't find a job. Guys, I know it's frustrating. I know it is. But you know, I have said that when I was in the job seeking process and I got the door slammed in my face for those 2 months, it was not a good feeling. But then when I was told to go to the temp agency, I resisted naturally, because I was like, what? Temp agency? But then when I got in there, that job, that temp agency led me to my first assignment, which was 3 months. Then it led me to my next assignment, which I was there for 8 months. And then that assignment was what I leveraged. All the things that I had learned in that second assignment was what I leveraged to get where I am today at my forever home. So if I can do it, don't fight me on this. Just do it. It doesn't harm anything. There's no charge to go and register with the temp agency. If they are charging, then don't register with them, because you should never be charged with a temp agency. I'm just saying. But yeah, guys, do that. And don't give up so easily on your dreams. You got to start fighting for your dreams, because your dreams are not going to chase you. You got to chase it. And let me remind you all once again that life goes by just like that. I mean, it is fast. And by the time you know it, where are you going to be? If you start pursuing what you want and you go after it, and even if you get knocked down, you get right back up. Because it's not about the number of times you get knocked down, it's about the number of times you get right back up. And if you need motivation, if you need encouragement, go through my videos, guys. I say it a lot, but in a way that is very blunt. And I'm saying this from a point of passion, because that's where I am. I mean, I hate to see adults get discouraged. I saw it a lot when I was in my trade school when I was learning medical coding. I saw that a lot, and it's just so hard to see that. And I use my channel, obviously my platform here, to be able to encourage all of you. It's up to you to take the advice. It really is. And there's nobody that's going to be able to do that but you. And nobody that's going to be able to win at this career but you. But you have to get in there. You've got to get into the fight. Because if you don't, pick something else, guys. There's a lot of other things that you can do. I'm just saying. So if this video helped you, I hope that you will like, subscribe, and share. And I will see y'all next time. Bye.